ACW is sponsored by HpDMS. Self-care through skincare. HpDMS is for everybody. Thank you for joining ACW Podcast. I am Robin Gabriel-Parson, your host. Now, throughout the month of November, we have been discussing diabetes and culture, and we have had amazing co-hosts providing resources and information around diabetes. Today, our co-host is Dr. Melvin Pierson with Pierson Dental. Dr. Pierson specializes in general dentistry, orthodontics, and periodontics. His discussion today will be centered around dental care and diabetes. So stay tuned. We honor and thank everyone in the fight for social justice. Teachers, healthcare workers, and all of you in high-risk jobs. We know it's stressful, so we have a gift of thanks from us to you. For more information, visit HpDMS.com. That's JABODI.com. You are listening to ACW Podcast. I am Robin Gabriel-Parson, your host, and our co-host is Dr. Melvin Pierson with Pierson Dental. Welcome, listeners. Welcome to ACW Podcast. I am Robin Gabriel-Parson, your host, and I am pretty excited about today. Throughout the month of November, we have been discussing, or should I say highlighting, diabetes and culture, and how diabetes has effect and is very harmful to your health. But did you know that diabetes can also impact your dental health? Well, no, here's the thing. Let me kind of explain a little bit. Research has identified that serious gum disease and diabetes can run both ways. So in other words, people with diabetes are at risk of developing serious gum disease. And gum disease may it's just difficult to control. Should I say difficult to control your blood glucose? Now, to further discuss the effects of diabetes and dental health, we have a very special guest here today, and he's a very dear friend of mine, and I'm really pleased that he's going to join us, and he's going to provide a lot of his information and resources for us today. So today, I have Dr. Melvin Pierson with me with Pierson Dental. He specializes in general dentistry, orthodontics, and periodontics. So, Dr. Melvin, welcome to ACW Podcast.
Oh, I'm very pleased to be here. Thank you so much for having me.
Dr. Pierson, before we move further on, I want to give our audience some of your background, the areas you've studied, just to give some background in reference to our audience understanding who you are, what you do, and how you really contribute to this whole conversation.
Okay, well, first and foremost, I am a proud native of New Orleans, Louisiana. Who dat? Yes, I'm from New Orleans, and I never intended my career to leave me out of New Orleans. But, sometimes you just follow the path of the Creator and you never know where you're going to end up. I'm a graduate of Dillard University and Howard University. I am a former faculty member in oral medicine at Temple University. I am also a graduate of New York University. I have been heard on just about every media outlet in the greater Philadelphia area. I've been on ABC, CBS, NBC, and Fox. I am a past president with the New Jersey Academy of General Dentistry. I am a past marketing chairperson for the National Academy of General Dentistry. I've been voted several times as a top dentist in South Jersey. And some of my articles have appeared in Essence, AARP, and Parrot magazines. So I have a large background where I can pull information from. I like to refer to myself as a walking Wikipedia of dental information. So I think your listeners will be able to gain something from this, and hopefully I can be able to break it down and get them to understand the importance of all of this stuff.
Thank you, Dr. Pierson. I appreciate that. Appreciate that. So you have such a plethora of resources and information, and thank you for that. And I just hope today our listeners be able to take some of your recommendations and really encourage our listeners. If you haven't been to the dentist, please do so, because what we're going to talk about today is very serious. Now, again, I'm just going to, for my listeners who are just joining us, I want to ask you again to kind of explain again then why the African American population is such at risk when it comes to diabetes. Can you just share with us again?
Well, yes, diabetes affects millions of people per year. And just some statistics, about 29 million Americans are affected with diabetes. That's about 9 to 10% of all Americans, and 1 million cases are being diagnosed annually. In the African American community, we have about almost 3 million people more affected by diabetes over the age of 20. So diabetes in the African American community is affecting us at a lot younger age. And at the same token, diabetes is projected to reach an epidemic proportion by the year 2050, with 50% of African Americans born today are going to end up with diabetes. So just let that sink into your listeners for a few minutes. 50% of the people born today are going to end up with diabetes in the African American community. That is a huge number. And a lot of the times, diabetes is actually not diagnosed, let me take that back, is actually suggested for diagnosis in the dental office. I can't tell you and your listeners how many patients I have referred to a physician because I suspect they are diabetic.
ACW is sponsored by HpDMS. Self-care through skincare. HpDMS is for everybody. You are listening to ACW Podcast. I am Robin Gabriel-Parson, your host, and our co-host is Dr. Melvin Pierson with Pierson Dental.
Wow, that's quite interesting. You go to the dentist and you leave the dentist with a total different diagnosis. But that is something that I hope many dentistries are paying attention to, because many times, you will not get that recommendation. Most dentists, they're there to do your teeth. And when you see signs of diabetes, I don't know if it's their job to recommend for them to see a doctor, but I appreciate that, you definitely share that with your clients. Now, there's something very interesting I want you to talk about, and I like the way you categorized it in your PowerPoint, and it was pretty much connecting the dots. Now, in reference to the 5 ways diabetes affect our mouth, can you elaborate on that?
Yes. The mouth is the gateway to the body. I know a lot of people now are trying to get healthier by exercising. They're trying to eat healthy foods, but there's no way to get anything into the body except IV, of course, but through the mouth. So if the mouth is infected and bacterially laden, that's affecting the food. You can buy the most organic foods, you can buy the healthiest things, but you have to have a clean gateway. And that is one of the key segments about connecting the dots with dentistry and diabetes, because when things enter the mouth, bacteria that are in the mouth are activated by the eating process, and it is a circle. So I'd like your listeners to visualize a circle. What goes into the mouth goes into the digestive system, goes into the bloodstream runs within the mouth. So that entire circle does not break. So you gotta be healthy in the mouth and the mind to truly be healthy in the body.
Wow, wow. Now, there are different, and you broke it down in your PowerPoint in reference to these five ways
Yes.
diabetes affect. And yeah, and again, I'm not really, when it comes to dentistry and all the other different labels and diseases, we know periodontics is one, but kind of give us some more
I
different,
will.
yeah.
Okay. The number one way diabetes shows up in the mouth is what we call periodontal disease. When I started dental school, the term was pyorrhea. Graduating dental school, it was periodontal disease. Now it's called gum infection. All of these terms mean the same thing. Periodontal disease is painless. The individuals do not know they have it. It's usually caused by bleeding gums is one of the first signs of it. But most people are diagnosed with periodontal disease or gum infection during the dental checkup. So if you don't go to the dentist routinely, you don't know if you have periodontal disease, and you may not know if you have diabetes. So it starts with visiting the dentist every 3 to 6 months. It sounds old hat. It sounds like something you have heard all your life. Go to the dentist, brush and floss. Well, that hasn't changed. And the most common dental disease affecting people with diabetes is periodontal disease. Now, why is periodontal disease so crucial? Because A, it's painless, B, it's only picked up during a routine dental cleaning, and C, periodontal disease is the number one cause of adult tooth loss over the age of 35. Individuals saying they have missing teeth, or you see individuals with missing teeth, it is usually because of periodontal disease, not tooth decay, but periodontal disease. Another way diabetes affects the mouth is something called xerostomia. Huge word. What does it mean? Dry mouth. The mouth is a moist environment. The moistness is what helps the foods digest. So if you have a case of dry mouth, you're very hard to digest foods. It's very hard to balance the pH of the foods and drinks you're drinking. And that's another way diabetes affects the mouth. Diabetes causes dry mouth. And I'm sorry I'm not able to show some slides to your listeners, but if you have house plants and you look at the soil and the soil appears cracked, when you know the soil is dry and that plant needs water, well, that's the way the oral cavity starts to look. I'll glance in the mouth in 1 second. I'm like, okay, this patient has xerostomia. My next question is not a dental question. My next question is, when's the last time you had blood work? And do you know what an A1C is? So all of these things tie in. Another thing we can talk about is change of taste. Foods begin to taste differently. Remember, the mouth is the gateway to the body. Food begins to taste differently when you are affected with diabetes. And what do we do when food tastes differently? We reach for two things, sugar and salt. Well, sugar is bad for diabetes, and salt is bad for hypertension. So it's that vicious circle. I just want your listeners to visualize a circle, and you cannot affect one part of that circle without affecting the other. Either the circle is going to remain the same, get larger, or get smaller, but the vicious circle is still there. So when we experience change in taste, that's the third item. Individuals tend to reach for things that's going to throw off other organ systems in the body. Number 4, infections. The human body is going to be more common to infections with diabetes, and some of those infections show up in the mouth. there is an common infection called candidiasis or thrush. Candidiasis shows up in the mouth when a patient has diabetes because diabetes affects your immunity. And right now, immunity is one of the big reasons why we have so many people dying in the pandemic. They don't have the immunity to fight this. And some of those underlying conditions may be diabetes linked to periodontal disease, which is causing the infections and causing the lower immunity system. Again, the circle. And number 5 is slow healing. When a patient is diabetic, they heal very slowly. And that healing also affects the mouth. A simple sore that normally would heal in 5 to 7 days can go a month or 2 if that patient is diabetic. So again, connecting the dots, please, please, please have your listeners visit their dentist 3 to 6 months. Ask them, will you screen me for periodontal disease? Because what I found as a practicing general dentist for over 30 years, every dentist, every dentist doesn't screen for this. So that's where I started out the segment by saying, I feel our profession as dentistry is not doing enough to educate the public, because this is a simple step. And this is something that could lead into this more holistic approach of getting people healthy.
ACW is sponsored by HpDMS. Self-care through skincare. HpDMS is for everybody. You are listening to ACW Podcast. I am Robin Gabriel-Parson, your host, and our co-host is Dr. Melvin Pierson with Pierson Dental.
Thank you. I appreciate that. And the education around it. A lot of times we don't get the education, and I appreciate you sharing the importance of really people taking charge of their own health. Ask your dentist. And that's something that I never thought about, asking my dentist to screen me for, gum disease. That might not be in their plan, or even not screening, but noticing it and suggesting you should see a doctor. So I really appreciate that, Melvin. Now, also a question in reference to diabetes affecting your mouth. Now, how does diabetes affect your tooth? I mean, you kind of explained it, but your teeth in general.
Very good question. Because when a patient has diabetes, it shows up as periodontal disease. Now, there are 4 stages of periodontal disease. Stage number 1 is gingivitis. That's when your gums, your gums are bleeding. They become a little puffy, but again, no pain. The next 3 stages are problematic. You have mild periodontal disease, moderate periodontal disease, and severe periodontal disease. Again, none of these hurt. But how does it affect the teeth? Periodontal disease technically does nothing to the teeth. But what it destroys is the bone and supporting structures around the tooth. So let's visualize a tree planted in your yard. And the soil is holding the tree in, and it's a beautiful tree, and it bears fruit and all of this stuff. If you slowly, systematically dig around the top of the tree and continue to dig down, over time, that tree will get loose and eventually fall. That is how periodontal disease affects the teeth. It slowly, systematically, as a bacteria, it eats away at the bone that holds the teeth in place. So over time, the teeth become loose. So in turn, it didn't do anything to the tooth, but it took away all the support the tooth has. And by the time most patients realize it, they're at moderate or severe periodontal disease, where my only option is to extract a tooth. So this disease is so invasive that it just causes us to, that's why I said it was the number one cause of adult tooth loss. And according to the American Dental Association, 7 out of 10 Americans have this. You meet 10 people, 7 of them have some form of it. Me, myself, I am a diabetic. Me, myself, I have a mild form of it. But the difference is I can go in between a patient and have one of my hygienists clean my teeth. I have my teeth cleaned, maybe once every month. But most people don't have that luxury. So I'm a little more on top of it just because of what I'm around every day. But this disease will cause you to lose your teeth, which leads to more expensive treatments such as dentures, such as implants, and it just continues with that vicious cycle.
Now, Dr. Melvin, what I find interesting also, and you mentioned this earlier in the conversation, is a lot of times in our African American communities, we don't have the resources. So going to the dentist is almost like a luxury for a lot of people. So they walk through life a lot of times with these dental issues, and because they don't have the resources. So what would you recommend for people who do not have the resource or expenses to get the help they need? I know there's a lot of community clinics, but then a lot of community clinics the type of service that they provide is so very limited. So how do we really help our at-risk communities who may not have the resources? Are there some things you can suggest that can help people?
That's a very, very good question. Number one, I would recommend in your areas, look for dental schools. In New Orleans, there is Louisiana State Dental School. You get very, very good, I would go as far as to say excellent care at the dental schools. And it's at a fraction of the cost. You're going to trade cost for time. At the dental schools, it's going to take you more time to get through the treatment, but it's going to cost less. And a lot of the schools have what we call a sliding fee scale. And what that means is they will treat a patient based on their income, and that will determine their costs. So an individual that's single and has a certain income may only pay 60% of the cost, but an individual with maybe a family of 4, they may pay as low as 20% of the cost. So you want to look for A, dental schools, B, dental clinics. And if you're looking for a dental clinic, do some extra legwork. Look for one that's called an FQHC, a federally qualified health center, because number one, the federal government is subsidizing them, and number two, they also work on a sliding fee scale. But the listeners need to be educated and make sure they know what they're getting. Ask them, I'd like to be screened for gum infection. So let me just elaborate a little bit more what they need to look for. When you're screening someone with gum infection, they're in the mouth and they're calling out a series of numbers. You may hear 3, 2, 3, 5, 6, 5. And people will ask me all the time, well, what do those numbers mean that you guys are calling out? What those numbers means are measurements in millimeters. To be healthy, you need to be 3 or less. So if your dentist is going in your mouth and you're hearing numbers 3, 2, 3, 2, 2, 2, 2, 1, 2, you're healthy. The further you move away from 3, when you start hearing 5s, that's a cause for concern. I had a patient in the other day. This patient was up to 10 and 12 millimeter pockets. And the
What
patient
happened?
only wanted to get their teeth whitened. And I'm saying to myself, you're about to lose at least 12 teeth, and all they're concerned about is whitening. So again, it comes down to really educating the public. Yes, we all want whiter teeth, but it should start with we want healthy teeth and then progress to whiter teeth. So again, these are the things you look for. Dental schools, FQHCs, federally qualified health centers. And if you're lucky enough to have insurance, you can go to a private dentist. In my particular office, we have an in-office plan. Some offices may offer that. You may say, contact the dentist of your choosing and say, look, I don't have any insurance, but do you have an in-office plan? A lot of us have that now.
ACW is sponsored by Jabati. Self-care through skincare. Jabati is for everybody. You are listening to ACW Podcast. I am Robin Gabriel-Parson, your host, and our co-host is Dr. Melvin Pierson with Pierson Dental.
Thank you. That's good to know. That's good to know. I didn't realize that. But you're right. As a patient, you should ask your dentist, what type of plan do you have? So thank you for that. Now, you mentioned earlier, and I just want to go back to it just to review a few things for our listeners who are just joining in reference to symptoms of diabetes in the mouth. You mentioned excessive thirst. What other symptoms should you be looking for besides that?
Excessive thirst. Well, excessive thirst and change in the taste of your food. Which again opens up a whole nother Pandora's box. On the surface, it sounds so simple. Excessive thirst, change in taste of foods. But what do most of us do when we come excessively thirsty? Well, sometimes we grab a soda. Sometimes we grab a sports drink. Well, sodas and sports drinks are both high in sugar. And that's why diabetes carries the nickname of sugar diabetes. It's excessive sugar in the blood. So now, because diabetes has changed and made you excessively thirsty, you go and grab the two things that's going to make it worse in soda and sports drinks. Then I'll have some people come back and say, okay, well, I'm really thirsty. Let me go get a cold one. So they'll go throw down a cold beer. Well, beer is high in acid content, and beer and wines stain your teeth. Wine is higher sugar content. Wine is more acidic, and wine decreases saliva flow. Why is saliva important in the mouth? Well, saliva is the mouth's cleansing mechanism. Saliva is like the mouth taking a shower. Saliva is what cleanses the mouth. So if you lose that cleansing effect, now you're promoting more tooth decay. Again, everything is a circle. You cannot affect one single thing without affecting the other. So again, sodas, sports drinks, beer, wines. If I ask the show of hands, how many of you have reached for these things when you're thirsty? And then some of your listeners are saying, well, no, not me. I only drink water. Well, let's talk about water. What type of water do you drink? Do you drink Dasani? Do you drink Essential? Do you drink Poland Springs? Or do you drink the tap water? Well, most bottled waters do not have fluoride in them. What is fluoride? Fluoride is a natural found element, and fluoride has been placed in tap water specifically to decrease tooth decay. All of this stuff sounds old. We've probably heard it all of our lives. Drink 8 glasses of 8 ounces of water. So 8-ounce glasses of water per day. Drink that per day. Why did we come up with 8 ounces and 8 glasses? Because within that, the dental community has placed a certain percentage of fluoride, and that fluoride keeps down tooth decay. So let's back up to your question. A patient now that's diabetic has excessive thirst. Let's say this patient now drinks all bottled water. Well, now this patient may be satisfying the thirst caused by diabetes, but they're promoting tooth decay. I had a young man come into my office last week. Young man with his family, IT guy, has a really good job, really great dental insurance. And I'm talking to this young man, and I realize he has 14 cavities. So when I see that, I take out my camera, it's about the size of an ink pen, and I start showing him the cavities on a big screen, a 50-inch screen in the treatment rooms. And he's looking at it and he says, all of those are cavities? I said, yeah. I said, tell me what you do for a living. He says, I'm an IT manager. I said, so let me guess. You sit at a desk all day. Yeah. I said, you're sending emails back and forth and sending technicians to where they need to go on the jobs. He says, pretty much. I says, and I'm betting you're having a big bottle of water sitting on your desk. Oh yeah, I drink bottled water all day, Doc. I'm trying to be healthy. Well, that bottled water he's drinking may be making him healthy, but it's not making the teeth healthy. It doesn't have the fluoride in it. So I says, listen, do yourself a favor. Go to Sam's, Walmart, Target, any retailer. I don't promote any of them. I don't have stocks in any of them. But get you a large refillable container and only drink the tap water. That is where the fluoride is, and that is what's going to help you get past this tooth decay. Because let's face it, if I fix those 14 cavities and he continues to do the same thing, he's going to be right back in the chair a couple of years later with more tooth decay. So connecting the dots, excessive thirst, drink tap water. Changes in taste in food. Maybe we can get a nutritionist on to say something, what we can do to season our food better than going with the salt and sugar. But these things that we commonly do are bad for us.
ACW is sponsored by HpDMS. Self-care through skincare. HpDMS is for everybody. You are listening to ACW Podcast. I am Robin Gabriel-Parson, your host, and our co-host is Dr. Melvin Pierson with Pierson Dental.
Thank you for that. And I found that to be very interesting because right now our society is so into buying water. Buying water is the most healthiest thing, but not thinking that if you just go to your zinc or you're at home and get tap water, that is something that's going to help you with your dental work. Never looked at it like that. So I appreciate you adding that to it.
In fact, there was a study done about 12 years ago when the bottled water craze really started coming on as to why people would go out and buy something that they could get at home or at their jobs for free. And most people, you would think, get bottled water because they say it tastes better. But this study didn't prove that. This study proved that the number one reason individuals bought water was because of convenience. That's why when you look at the water bottle, it's shaped a certain way. It's ergonomically shaped to fit your hand. It's specifically shaped to fit in the cup holder. The bottled water people have made it convenient for you to get it. And they make it look designer, like Voss water. They make it look like something chic that you would want to carry and be around. It's not that it's any healthier for you. And there are some that has fluoride in it. And I'm not exactly sure which one it is. The one I knew of was Dannon. But Dannon only makes the small sizes, which was to go into your kids' lunch boxes. But they don't do it in the larger ones. There are some, I don't want to get into trouble with who has it and who doesn't, but just like buying anything else, read the label. See if it has fluoride in it. And what happens when you drink something that doesn't have fluoride in it? How would you decrease tooth decay? If there's no water around, you can't brush, what do? Well, you buy sugar-free chewing gum. And again, it all comes back to everything else, reading the label. I don't promote any type of sugar-free gum, but make sure it has 2 words in that label, sorbitol and xylitol. 2 big sounding words that will save you a lot of money and time in the dental office. Sorbitol and xylitol are 2 ingredients in certain sugar-free gums that actually promotes or decreases, I should say, tooth decay. So it's not just any sugar-free gum. So if you can't do anything but drink bottled water, then consistently chew sugar-free gum with those 2 ingredients in it. So there's a lot of things we can do, but as I said at the beginning of the segment, it comes down to education, what you know, and what you're going to apply. That's the bottom line.
You are so correct. Thank you for that so much, so much. Now, there's something I really want to touch on. It's really speaking to our youth. Now, since type 2 diabetes are found in children at such a very young age, what age do youth begin showing signs of gum disease? And have you seen an increase in the number of children that are being diagnosed or showing signs of gum disease?
Yes, there is a specific type of gum disease called juvenile periodontitis. It affects individuals around puberty, usually between the ages of 11 to 13. And within juvenile periodontitis, you could either have a generalized effect or a localized effect. Generalized meaning it affects all the teeth in the mouth, which is more rare. Localized mean it affects certain teeth. And unfortunately, in these juveniles, the teeth, the specific teeth it affects are the most important teeth in the mouth. Well, wait a minute, Doc. Are some teeth more important than others? Yes, the ones no one cares about. Everybody cares about their front teeth, how their smile look. That's
Right.
not the most important ones. The most important ones is the first molars. That's the teeth that determine how your jaw functions. Every word I've been speaking to your listeners today, you've been speaking. Every time your listeners say something, their bottom jaw moves up and down. And for that jaw to go in its proper resting place, it is based upon the first molar teeth. The top
Wow.
and the bottom first molar teeth. Those are the teeth nobody care about. Hey, Doc, it's in the back. Don't fix it. Just take it out. And they're setting themselves up for possible TMD, temporal mandibular dysfunction. They're setting themselves up for dentures. They don't see it at the time. Dental decisions are long-term decisions. Individual patients don't see it that way. Doc, this tooth is killing me. I couldn't sleep last night. Just take it out. You're making a decision now that's going to affect you the rest of your life to take it out. I had another patient come in with that scenario. Doc, just take it out. Just take it out. So I looked at the young man and said, what do you do for a living? He says, I'm a mechanic. I said, are you a good mechanic or just a mechanic? He says, Doc, I'm a good mechanic. I said, you right or left-handed? He says, I'm right-handed. I says, okay, so you're doing your work. It's good. It's coming out great. But one of the tools slip and injure one of your fingers. And I grab his finger. I put my hand on his index finger of his right hand. And I says, now they rush you to the hospital. And the doctor tells you, okay, I could fix this finger back and it'll be 95 to 97% of what it was. Or do you want me to just take it off? He says, no, I tell him to fix my finger. I says, why would you tell him to fix your finger? Because my finger is important. And I says, well, wait a minute. You got 9 more fingers? No, doc, I need this. I'm right-handed. I need this for my work. Key word, for my work. Most jobs individuals can do or how they function every day, they can do it without teeth. And individuals, patients don't link teeth as a body decision like they would a hand or a finger on an extremity. So what happens is the same guy who tells me take the tooth out, now he understands the story. I'm like, well, I could just take it out. You have more teeth. Now, because he understands the importance of his finger, he now sees the importance of his tooth. And I'm like, this tooth has a specific function. If you don't believe me, talk to a family member or a friend who's missing a tooth. They will tell you they shouldn't have got it done, but it's too late now.
ACW is sponsored by HpDMS. Self-care through skincare. HpDMS is for everybody. You are listening to ACW Podcast. I am Robin Gabriel-Parson, your host, and our co-host is Dr. Melvin Pierson with Pierson Dental.
That's interesting, and I like that analogy behind it. That is so interesting. That's so interesting. Dr. Pierson, we truly appreciate all of your information. You really shine a light on a lot when it comes to dental health and the seriousness behind it. Again, and I'm guilty myself. Dental for me is like, oh, secondary. I'll do the medical thing. Just go to doctor. For things that I feel is important, but it's very important, as you mentioned, in reference to dental health, and just the fact where you brought up the placement of your jaw. I never thought of it like that. And it's quite interesting. So the education behind it alone is so valuable. And we truly appreciate you, Dr. Pierson. So is anything else you want to add to the conversation to encourage people to go to the dentist more? And especially for our youth, what can we tell our parents that we need to really pay attention to?
Well, I would say, please visit the dentist 3 to 6 months. And the reason, you've all heard on TV, go every 6 months and brush and floss. I say 3 to 6 months. And the reason why is because these bacteria that are in your mouth reorganize in 3 months. So let me just paraphrasing something here. We've talked a lot about periodontal disease and gum infections. Can the dentist treat gum infection? No. It has to be a marriage between the dentist and the patient. The only thing I can guarantee a patient is that when they come into the office with periodontal disease, when they leave the office, their mouth will be free of bacteria. They have to do leg work at home. So if this patient isn't willing to commit to what it needs to do at home, it doesn't make any sense to pay us to do this procedure. They have to now diligently brush and floss 2 to 3 times a day. Oh, doc, I can't do that. That's too much. There's a problem right there. It is a commitment. You have to be committed to your teeth, or literally they're going to be false to you. You have to commit to them. So we're going to get the information, the inflammation, the bacteria off your teeth, but you have to do what you have to do at home to keep it off. So it is a marriage. Unlike a cavity, Dentist can fix a cavity. Come in, we take care of it. A dentist can take a tooth out. You sit there, nothing else happens. Periodontal disease, a lot like diabetes, deals with lifestyle modifications. If you're a diabetic, you can't have all of this salt. You can't have all of this sugar. You can't do things. You have to change your lifestyle. With hypertension, you have to change your lifestyle. To have healthy teeth, you have to change your lifestyle. This is no different. To be in a committed relationship, you have to change your lifestyle. So this is not a dental lesson. This is not a lesson on periodontal. This is life. Everything that is going to be successful requires a commitment. So as far as the parents are out there, start your children early, get them going to the dentist early, and please stop scaring them with threats. I'm going to take you to the dentist and let him pull out your teeth. Don't do that.
That is
Don't
so
do
true,
that.
though. That is something I've heard in my childhood, and it becomes a threat, almost like I'm fearful of the dentist. And when you think about it,
so you're growing up a generation of people who has this fear, and what you have done is taken a 5-year-old child and set that child up for dentures. No parent wants their child to fail. No parent wants to say, hey, my child is going to grow up to be nothing. No, they want them to grow up to be something. They want them to be smart. They want them to do things in life. Well, you're doing the opposite by threatening the kid with going to the dentist. You have just set that kid up for dentures, to be a functioning adult with no teeth. That's what you've done by putting that fear there.
that's true.
How young do we start seeing patients? How young do we start seeing children? 6 months after the first tooth develops. 6 months. The child is a toddler, and I'd like him in the dental chair. If I don't do any more than put on a pair of gloves and they let me look in the mouth. Because 6 months from now, that same child is going to remember me, and I didn't do anything to hurt them. Maybe 6 months later, this same child would let me clean the teeth. Maybe they're not ready. Maybe they still cry and don't want to do it. The parent will say, I'll hold them down. No, you holding them down is going to make the child say, when I see that man, I get held down and he hurts me. No, I say,
And I'm
listen.
not going there. Right.
I'll say, listen, don't force him. There's no charge for today. We will bring him or her back in 6 months when they're a little older, and we'll try this again. We are planting seeds in the young people that we try to get out of them as adults and wonder where it came from. It came from the parents and the dentist. So again, the dentist and the parents are a marriage. The dentist and the kids are a marriage. The kids and the parents are a marriage. It is the circle again.
Yes.
Everybody's got to be committed and on the same page.
Yes, you're so correct. You're so correct. And thank you so much. You really encouraged me because I have grandchildren and I have a young teenager. And matter of fact, they have a dentist appointment next week. So
excellent.
So I am definitely on board. And I want to say I was one of those childs. I grew up in the 60s. I grew up, in the 70s, whereas dentistry was a luxury for us. And, going to the dentist was not something that was priority. So a lot of times we got our teeth pulled with thread at home. You pull your own teeth. So I really appreciate you shining light on this and showing our audience it's a new day now and we got to approach dentistry differently. And it's very important. And I'm just adding to what you're saying in reference to starting at a very young age, because it's all about behavior. It's all about that child understanding first thing in the morning, even at lunch and even at night, floss, brush your teeth, so is important. I appreciate everything that you shared with us today. I wish we could continue our conversation. Dr. Pierson, please share with our listeners your contact information. If anyone would like to contact you or talk more about the education side of dentistry, how can they get in touch with you?
Well, you can get in touch with me online by visiting PearsonDental.com. We have a very elaborate system where you can call and leave a text message. I see the text messages. You can email me at pdastaff@gmail.com. We're very accessible. We're very reachable. And as I said in the beginning, I'm from New Orleans. You can't miss me because I'm the guy with the fleur-de-lis in my logo. So you can't miss me.
Okay, thank you. Appreciate it. So listeners, thank you for joining us today. This is Diabetes Awareness Month, and we're talking about diabetes and culture. We will have some more amazing hosts that are going to join us. We're going to be speaking about diabetes. But until then, join us next Wellness Wednesday. Everyone, please live with intention, purpose, and love. Thank you.
Thank you so much for having me. It was my pleasure.
ACW is sponsored by HpDMS. Self-care through skincare. HpDMS is for everybody.